Lupus types, treatment and precautions. Lupus, also known as systemic lupus erythematosus, SLE, is a chronic autoimmune disease that can affect multiple organs and tissues in the body. There are several types of lupus, including systemic lupus erythematosus, cutaneous lupus, drug-induced lupus, and neonatal lupus. The treatment and precautions for lupus depend on the type of lupus and the severity of the disease. 1. Systemic lupus erythematosus, SLE. This is the most common type of lupus and can affect multiple organs and tissues, including the skin, joints, kidneys, lungs, and brain. The treatment for SLE includes medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, antimalarials, corticosteroids, immunosuppressants, and biologic therapies. Precautions for SLE include avoiding exposure to sunlight, which can trigger flares, and maintaining a healthy lifestyle, including regular exercise and a balanced diet. 2. Cutaneous lupus. This type of lupus affects the skin and can cause rashes, lesions, and hair loss. The treatment for cutaneous lupus includes topical corticosteroids, antimalarials, and photoprotective measures, such as wearing protective clothing and sunscreen. Precautions for cutaneous lupus include avoiding direct sunlight and using broad-spectrum sunscreen with a high sun protection factor, SPF, when outdoors. 3. Drug-induced lupus. This type of lupus is caused by certain medications, such as hydralazine, procainamide, and isoniazid. The treatment for drug-induced lupus involves discontinuing the offending medication and managing symptoms with NSAIDs or corticosteroids. Precautions for drug-induced lupus include regular monitoring of medication side effects and avoiding medications known to trigger lupus. 4. Neonatal lupus. This type of lupus occurs in infants born to mothers with lupus who have specific autoantibodies. The treatment for neonatal lupus includes supportive care for symptoms, such as skin rash and low blood counts. Precautions for neonatal lupus include close monitoring of infants born to mothers with lupus and prompt treatment of any symptoms that arise. In addition to medical treatment, it is important for people with lupus to take certain precautions to manage their disease, including getting regular checkups with their healthcare provider and following a treatment plan, avoiding smoking and secondhand smoke, limiting alcohol intake, maintaining a healthy weight, getting adequate rest and managing stress, avoiding infection by washing hands frequently and avoiding contact with people who are sick. It is also important for people with lupus to stay informed about their disease and to seek support from family, friends, and healthcare providers.